Right? So today we are going to talk about the crisis theory and intervention. First of all, we have to know what is crisis. Crisis is a temporary state of severe emotional disorganization caused by an event that present a threat. Here we can say some event or what our body responds. So overwhelming events that causes the significant psychological stress we call crisis. So sign of the mental health crisis, maybe rapid mood switching, sometimes manic, sometimes depressed, extreme lack of energy, severe agitation, excessive talking, also feeling like people are out to get them, or hallucination, delusion, or isolation self from friends and family, or not eating, weight loss, or always eating and weight gain. Also, so everyone experiences some crisis in life. The outcome depends on how you coping mechanism when in need or or support system available at the time of crisis. The ability for decision making and problem solving is inadequate, so we face crisis. And treatment is aimed at assist the client and family through the stressful situation. So today's chapter is crisis theory. So crisis theory predicts that the closer intervention is to the crisis and greater the success of the intervention. So here we go, some example or type of crisis. So mental health crisis, basically a situation when an individual emotional thoughts or behave put them at the risk of harm themselves or others. A crisis can also be defined as a person who is unable to care for themselves or difficult for them to manage food, shelter, or even clothing. So first one is called maturational crisis. So maturational crisis, crisis, a life crisis in which the usual coping mechanisms are inadequate in dealing with the stress common to a particular stage in life. So with life, so they said the maturational related to developmental states and associated role change. Example include marriage, birth of a child, and also retirement. So maturational crisis. So some sometimes it is called developmental crisis. So are predictable events in normal course of life, such as leaving home for the first time. So example, you living with your parents, but you got chance in a university. It is in the different city. You living in Florida, you got admitted in California. So it is the first time you have to leave home, right? So maybe it is situational crisis. Sometimes everybody's coping mechanism is not same. Like getting married, having a baby, or beginning a career. So all of this is the example of maturational crisis or developmental crisis. So developmental crisis, as I told you, predict time of stress in everyone's life, which occur in response to transition from one stage to another in life cycle, right? So maturational crisis, life change, events that occur as a normal part of development. Next one is called situational crisis. Arise from an external source, is often unanticipated, and is associated with life events that upset an individual or groups of psychological equilibrium. Example include loss of job or a change in job, change in financial status, death of loved one, divorce, abortion, addition of new family member, pregnancy, and severe physical and mental illness. So, situational means unexpected life events. As I told you, job loss, sudden death of loved one. So it is sometimes for someone it is difficult to adapt themselves in this condition. So situational crisis basically is a precipitated by various life events and is not anticipated. And change, I mean, sometimes it is called sudden or unexpected crisis, because situational crises are sudden occur or unexpected, such as that, like example, accident or natural disaster, on getting in a car accident or experience of flood or earthquake or being the victim of a crime are just a few types of situational crisis. So a midlife crisis is one example of a crisis that is often rooted in external anxiety. Another crisis is called advantageous crisis or social crisis. So it is related to a crisis of disaster, is not a part of everyday life. It is unplanned and accidental. Advantageous crisis may result from a natural disaster, that is flood, floods, tornadoes, and earthquakes. A national crisis like war, the riot, airplane crash, or a crime of violence like rape, sexual assault, murder, bombing, or child abuse. So advantageous crisis, it is sometimes it is natural disaster like tornado, or natural or national emergency like terrorist attack, or violence the crime. So all of this condition, as a healthcare provider, as a nurse, we provide for patient a safety, assist with anxiety reduction, assist the patient for or assessment patients' perception of the events and their support system, that is family, friends, and ask the patient about the coping skill used in the past. Here, some phase of crisis. Phase 1, called external precipitating events, could be situational, developmental, cultural, or social. Phase 2, perceptions of the threat, an increase in anxiety. And 3, or C, try to make coping or resolve the crisis. Phase 3, failure of coping and increase the disorganizations. It means patients are not adjust, not adapt, not able to cope, and problem increase. Emergencies of physical symptoms, relationship problem. Phase 4, mobilizations of internal and external resources. Goal is to return the client to at least a crisis level of functioning. So, crisis intervention, how we manage all of this problem, crisis intervention. So, treatment is immediate, supportive, and directly responds to the immediate crisis. The interprofessional healthcare team assists individual in crisis to cope. Intervention are goal directed. So we provide the patient safety first, assist with anxiety reduction. We go for assessment the patient's perception of the events and their support system, like friends, family. Also, we ask the patient about the coping skill used in the past. Feeling the client are acknowledged. Intervention provide opportunities for expression and validate of feelings. Also, connections are made between the meaning of the events and crisis. The client explore alternatives, coping mechanism, and try out the new behavior. So the crisis intervention typically involve 5 components. Some books said promoting safety and security and exploring the person's experience with disaster, identifying the current priorities, needs, problem, and possible situations, also assessing the functioning and coping skill, providing reassurance, normalizing, and psychoeducation. It helps to adapt with the crisis.